Okay, so let's just talk a bit about hepatic dysfunction. So I know they're using a hepatitis C viral infection here, but this would go for many things that's harming the liver. So whether it's alcoholism, or some kind of metabolic disease that's injuring the liver, such as what's called NASH, non-alcoholic steatorrhea hepatitis. So there's just assume, so when we're looking at this slide here, the normal liver can be affected by many things. In this particular case, it's a viral infection. Okay, and then what happens? So over time, if the disease is continually affecting the liver, you're going to initially just have an acute hepatitis. Okay, meaning that the liver is acutely inflamed. If this was to continue for a week or 2 weeks or 3 weeks, okay, we'd call it acute hepatitis, and if it resolved, the liver would return to normal. If it persisted and lasted beyond 6 months, we would call it chronic hepatitis from whatever the cause is. Chronic hepatitis is causing chronic inflammation of the liver. All those little units that we just looked at on the previous slide are inflamed and irritated and not functioning properly. So they're not making bile, they're not filtering the blood properly, they're not metabolizing properly, they're not making proteins as well. So that would be called chronic hepatitis. And if chronic hepatitis goes on for years or decades, you'll finally get to cirrhosis, which is scarring and fibrosis and shrinkage of the liver. And all those units are just gradually being completely obliterated. And you can live with cirrhosis for years. Not very well, because you're going to get a lot of symptoms and signs. And finally, because of all this chronic inflammation and cirrhotic changes, you can develop hepatocellular carcinoma, so liver cancer, end-stage liver disease, and finally death. Okay, so it's a spectrum that happens over years. It can happen in a shorter time depending on the disease, but this is the general, this is the spectrum of disease that the liver goes through before it finally stops functioning. So the liver is an amazingly tough organ. Okay, so this slide, spectrum of liver disease, really carries on from the slide before. So we were talking about, okay, well, how does liver disease progress? So you have a normal liver, fully functioning, carrying out all its functions, and you get hepatitis. So it could be a viral hepatitis that we'll come to. It could be a drug-induced hepatitis that you ingested, and we'll mention some of those later. So anything that causes inflammation of the liver is called hepatitis. And if it's acute, then typically it'll last days to weeks, and then it resolves and the liver returns to normal. It'll still have symptoms and signs that we'll see, and we'll review those, but it resolves. A chronic disease is, so a chronic hepatitis is where it lasts at least 6 months, and there's ongoing inflammation and loss of hepatocytes. And that, as mentioned, can be from viruses, toxins or drugs, fatty liver, that NASH syndrome that I mentioned, non-alcoholic steatorrheic hepatitis. So we'll mention that a bit more because that one's becoming more common. And then finally, this chronic hepatitis, the liver says, I can't continue to maintain all these hepatocyte units. There's too much scarring and fibrosis, and cirrhosis takes over. And that is continued chronic inflammation, but now you have a shrunken, scarred, fibrotic liver, which is functioning minimally. And finally, as the cirrhosis progresses throughout the entire liver, you have decompensated cirrhosis, meaning I can't maintain my functions at all. And this is where the patient gets into big trouble with all kinds of symptoms and signs. We'll go over all of them. Okay, so let's just look at the top left there. So you have some liver inflammation. So say you took a drug, it inflamed your liver a bit. Let's say a cholesterol drug, a statin, and it inflamed your liver a bit. So you have a bit of right upper quadrant discomfort. Maybe you have a bit of a fever, nausea, vomiting, and fatigue. And then this very mild hepatitis resolves, especially once you take away the offending agent, such as a drug. Okay, so that's the green. So very self-limiting, minor inflammation of the liver. So now let's go to the next color. It kind of looks orangey, salmon colored, and it says liver necrosis. So this is where we're talking about hepatitis. So inflammation and damage to the hepatocytes. So here's where we're looking at significant drug toxicity to the liver, and there's many chemotherapy agents that can do that. Again, I mentioned statins. Statins can give you a hepatitis. Viruses, so viral hepatitis, whether it's there's a number of different viral hepatitises that we'll speak about, which will clear that up a bit later. But let's just look at some of the symptoms and signs that are going to happen when you have hepatitis from any cause. So the first one is decreased bilirubin metabolism. So that's basically, so bilirubin is the breakdown product of heme that comes from hemoglobin. So your red blood cells are continually being produced by the bone marrow and broken down after 90 to 120 days in the spleen and the liver. And the hemoglobin has the globin part, which is a protein, and the liver is more than happy to reuse those proteins, break them down into amino acids and make other proteins. The heme group gets broken down to bilirubin. Okay, so the iron group, the iron part of it gets recycled, and the heme turns into bilirubin to be excreted. Okay, well, if you have hepatitis, it's not going to be excreted very easily because you're not making as much bile. And you can get hyperbilirubinemia in the blood. So that's elevated bilirubin in the blood because the liver's not excreting it as easily. And you will get jaundice, which is yellow coloring of the skin. And in particular, you'll see it even better in the whites of the eyes. They'll be yellow, and that's called scleral icterus. Okay, so this is just from lack of processing of bilirubin by the liver because it has hepatitis. Decreased bile in the gastrointestinal tract. Well, that's going to happen because the liver is not making as much bile, so it's not excreting as much bile. And bile is what gives your stool some color. Okay, so the brown color of stool is from bilirubin. So you will have light colored or clay colored stools. So if someone comes in and says, you know, I'm not feeling well and my stools look very white or beige, okay, that can be a symptom of hepatitis. Decreased vitamin K absorption. So with hepatitis, you're not processing your fat-soluble vitamins as well. You're not able to store them as well. And one of the fat-soluble vitamins is vitamin K. And if you don't have vitamin K, you can't produce some of your clotting proteins in the coagulation cascade. So you will be at higher risk for bleeding because your ability to clot blood is diminished. And lastly, in this group about, lastly, the urobilinogen. So urobilinogen, so there's bilirubin in the bloodstream giving you jaundice. Well, that's going to get filtered by the urine and by the kidneys and go into your urine. And it's going to make your urine look dark, okay, tea colored. So if you can imagine a strong tea color, that's what it's going to look like when you have too much bilirubin or urobilinogen in your urine. So dark tea colored urine. Okay, let's move on. This is going to be a long slide, but it'll help you understand what the liver does. So next one down is decreased metabolism of proteins, carbohydrates, and fats. Well, all those are coming back from the portal vein. So if you're not metabolizing and processing the proteins, carbohydrates, and fats that are returning to the liver, you're at risk for hypoglycemia. The liver is not able to store as much glycogen because it's sick with hepatitis, so it's not producing the same amount of glycogen. You are not producing the same amount of albumin, which is the main protein in the bloodstream that maintains plasma volume because it provides the oncotic pressure. Remember, the hydrostatic pressure is what pushes fluid out of blood vessels, and the oncotic pressure moves it back in. So as albumin drops, you get more and more edema, and then you can get ascites, which is fluid in the peritoneal cavity because it can't drain back to the liver. What else happens? Let's go to the right. Let's go down and to the left now. So altered hormone metabolism. So the liver is responsible for metabolizing many hormones. So you can get increased androgens and estrogens. Okay. So what happens in males is that one of the symptoms is the testicles will atrophy because of abnormal hormone metabolism of testosterone, estrogens. They're not being fully metabolized. You can get small breasts in men called gynecomastia because they have more of an imbalance and they have slightly elevated estrogen compared to testosterone. Abnormal menstrual cycles, loss of body hair. Spider angiomas are these little spots that look like these little blood vessels all over the body. They're called telangiectasia or spider angiomas or nevi. Palmar erythema is when you look at someone's palm and they have red palms. That's a sign of liver disease. Edema, of course, is again caused by reduced albumin. Activation of ADH and aldosterone is because the body is sensing a reduced plasma volume because a lot of it is not being reabsorbed back into the bloodstream since your albumin is low. So your kidneys are signaling, saying, what's going on? You have low circulating blood volume. Well, of course you do, because a lot of it's leaking out and not returning because there's reduced oncotic pressure from low albumin. So it activates ADH secretion and aldosterone secretion to reabsorb more water to try and compensate for the reduced circulating plasma volume. Okay, so a lot of things are going on. Let's go down a bit more. Elevated AST, ALT, and alkaline phosphatase. Those are liver enzymes. So when you have active hepatitis, they're all elevated in the bloodstream. Elevated bilirubin. We already spoke about that. Elevated prothrombin time or elevated INR because your clotting is abnormal. So the time to clot is higher. Your INR is elevated. Your PT is elevated. Reduced serum albumin, we've spoken about. And as this liver failure, if this liver failure really continues, this hepatitis becomes a fulminant hepatitis, then you're going to progress down the line here to liver failure. Hepatic encephalopathy is a condition where the liver is just not processing amino acids and protein metabolism. And when it wants to process amino acids, it gets rid of the nitrogen on the amino acid and sends it into what's called the urea cycle. We'll come to this again. So that urea can be excreted in the urine. So that because breakdown of amino acids produces ammonia normally, and ammonia is extremely toxic to the body. The body quickly converts it to urea in the liver, and then the urine can excrete the urea. In hepatic encephalopathy, the urea cycle in the liver isn't functioning well, and ammonia is building up. And ammonia circulating in the blood going to the brain causes hepatic encephalopathy, confusion, loss of level of consciousness is reduced, asterixis, which is a liver flap. We'll talk about that. And finally, you go into a hepatic coma. You're so obtunded and reduced level of consciousness that you have hepatic coma, and then finally death. And that would be from fulminant liver hepatic failure. The alternative, so there's one awful pathway if it was to continue. The other is over on the right there is to develop cirrhosis. So liver fibrosis and scarring, which leads to portal hypertension. So the portal vein, remember, is returning everything from the gastrointestinal tract. So if the liver is unable to accept all this blood because it's scarred down and fibrosed, and all the little blood vessels are also scarred down and fibrosed, then you will get backup of fluid in the abdominal cavity called ascites. You will get edema in the entire body because your albumin is not being produced. You will have an enlarged spleen because the spleen drains to the liver, but it uses the portal system. So because the portal system is enlarged, you'll have splenomegaly. If you have splenomegaly and liver and cirrhosis, you're going to impact many of your white blood cells. So anemia, thrombocytopenia, leukopenia, esophageal, so varices. So varices are distended, enlarged veins within the esophagus and often in the stomach too. So gastric varices, esophageal varices, and they're distended because they can't get blood back to the liver either because it's so blocked from cirrhosis. So they're enlarged and they can tear and bleed a lot. Hemorrhoids, because the anal cushions are filled with blood, and when they enlarge, they become hemorrhoids. Why do they become hemorrhoids? Because again, they drain through the portal system to the liver, and if the liver is cirrhotic, then they're unable to drain back. Superficial abdominal veins. So the blood is trying to find any other way back to the systemic circulation to bypass the liver because it's blocked. So, this isn't the time of this COVID-19 virus. So, and I'm at the hospital, so there's going to be some minor interruptions here and there. So the superficial abdominal veins, you'll see all these veins on people's abdomens, and we have a picture of it later, where the blood can't get through the liver because of cirrhosis. So it's finding other avenues to get back to the systemic circulation, and through the skin within these dilated veins is partly what it's doing. So don't forget, all of these things that happen in hepatitis, with the bilirubin, the decreased metabolism, all the hormonal changes, that also happens in cirrhosis. So it's all the kind of orangey salmon colored stuff plus the portal hypertension issues. Okay, so this slide on hepatitis is really just showing you what kinds of things can cause someone to have hepatitis. So acute hepatitis, okay, viruses, non-viral infections. So sure, you could have a parasite infect your liver, you could have a bacteria infect your liver. That will be much less common compared to viral hepatitis. Alcohol is definitely a toxin to the liver. So one of the most common causes of hepatitis is alcoholism, alcoholic hepatitis. Toxins and drugs. So many drugs can impact the liver and cause hepatocytes to be injured. So when you hear of a drug causing a hepatitis or a mild hepatitis, yes, that's exactly what it's doing. It's injuring the hepatic cells. Ischemic hepatitis, I wouldn't get too excited about. That just means a blocked artery to the liver, and then the liver starts to die, just like almost like a heart attack, a coronary artery occlusion. That wouldn't be very common. Autoimmune hepatitis, so sometimes the body itself, just like any other organ, can produce autoantibodies to attack the liver, and you can get an autoimmune hepatitis. Metabolic diseases is really referring to this condition that I'm calling NASH. And this term is non-alcoholic steatohepatitis. It's another term for non-alcoholic fatty liver disease. And it's an increasingly common cause of hepatitis and also leading to cirrhosis, this fatty liver. Now, chronic hepatitis beyond 6 months. Well, some of the viruses can continue to cause hepatitis. Alcohol, well, if you continue to drink alcohol beyond 6 months, you're going to continue to have hepatitis. Drugs, for sure. Continuation of drugs that are irritating the liver. There's NASH again, non-alcoholic steatohepatitis, which can be a chronic disease. It can be adjusted with dietary changes and weight loss. There's the autoimmune hepatitis again. And there's some hereditary causes of hepatitis. I'll mention a couple. They're not going to be on any kind of test right now. It's good to know for ATI and NCLEX later. So hemochromatosis is a buildup of iron in the bloodstream. It's a hereditary condition. There's also something called Wilson's disease, which is a buildup of copper in the liver, which finally leads to hepatitis and cirrhosis. Okay, so these are just the signs and symptoms of liver disease. Here's some early findings. You'll see a lot of them are very non-specific. Loss of appetite, weight loss, nausea, vomiting, constipation or diarrhea, fever, right upper quadrant pain. That's where the liver lives. malaise, just feeling lousy, fatigue, and an enlarged liver. Late findings. Well, late findings are going to be more hepatitis. They're going to be more specific. So hepatitis and cirrhosis symptoms. While the confusion disorientation will be from hepatic encephalopathy. That's from elevated ammonia. Arthralgias. Well, arthralgias aren't really specific to hepatitis, but if you have an autoimmune hepatitis, often autoimmune conditions can affect the joints as well and lead to some arthralgias. Urticaria, itchy, bilirubin building up in the bloodstream from liver failure and other toxins makes you very itchy. Okay, so liver failure patients often complain of a lot of skin itching. Edema. Well, edema is from reduced albumin levels. Okay. Ascites. Well, that's from portal hypertension, not being able to get the blood flow back to the liver, and also reduced albumin levels, so that you can't get the blood back into the portal vein because the albumin is so low. Jaundice we spoke about, that's from heme breakdown, and it's not being processed by the liver. Pruritus we mentioned, same as urticaria, it's itching. Bruising or bleeding, that's from decreased clotting factors, reduced platelet production in the bone marrow, because the liver secretes a hormone called thrombopoietin that activates platelet production. So not only are your platelets low, your clotting factors are low. And of course, dark urine, because you're spilling bilirubin into your urine and it looks dark, tea-colored. So let's go over jaundice, which is that yellowing of the skin and yellowing of the eyes from elevated bilirubin levels. I mean, you know, when you have a bruise, when you've bruised yourself, it changes all those colors, and one of them is yellow, and that's from heme breakdown. It changes that yellowish color. So jaundice. A good way to think of it is anything, so it's kind of like the kidney. Anything before the kidney we call pre-renal. The kidney itself is renal, and after the kidney is post-renal causes. So it's the same for jaundice. So let's start with pre-liver causes. And those would be things that cause red blood cells to break down sooner. So hemolytic anemia. So hemolysis is breakdown of red blood cells. So if you have a condition that's breaking down your red blood cells too fast, it will overwhelm the liver with too much processing of bilirubin, and you will get elevated bilirubin in your bloodstream and jaundice. So for example, a transfusion reaction, if you're given the wrong blood type, well, that's very rare now, luckily, but that can cause excessive red blood cell breakdown and jaundice. Sepsis, so when you're septic, you're often breaking down cells in your bloodstream because you have this overwhelming infection in your bloodstream, and that can create jaundice. Abnormal cells, sickle cell anemia, those are very abnormal cells. They're constantly breaking down, releasing heme, and then breaking down to bilirubin, causing jaundice. So any abnormal types of cells. There's another one called spherocytosis, where it's a congenital condition where you make really abnormal round red blood cells, and they break down quickly, and often those people have jaundice. So anything that's breaking down red blood cells before even the liver processing will lead to jaundice. What about liver disease itself? Just like kidney disease itself cause caused acute kidney injury. Now we're looking at the liver. So hepatocellular diseases. So damaged or diseased hepatocytes from hepatitis, such as from drugs or alcohol or viruses, cirrhosis, which is the end stage of liver disease, and you're just not processing the bilirubin anymore, will cause jaundice. Liver cancer or metastatic cancers to the liver will cause jaundice because the hepatocytes are being replaced by cancerous cells, and the bilirubin is remaining in the bloodstream. Okay, what about after the liver? Post-liver issues, obstructive. So if you have any reduced flow in the bile ducts because they're blocked, well, that's going to cause a backup of bilirubin into the bloodstream. If the little tiny bile ducts in the liver itself are blocked, say from hepatitis, because it's still in the liver and inflammation is causing irritation of everything in the liver, including the bile ducts. So that would be called intrahepatic obstruction. So you'll have reduced bile production and increased bilirubin because of hepatitis. If we're talking about the larger ducts outside the liver, such as the hepatic ducts, the common bile duct, if they're blocked, say with a stone that's blocking the flow in them, or a cancer of the bile duct, or a pancreatic cancer that's blocking the common bile duct, well, the bile can't flow. It's going to back up into the liver, which is then going to back up to the little bile ducts, and then finally it's going to back up and say, I can't take any more bile, and bilirubin is going to spill over into the bloodstream and cause jaundice. So skin is typically where we see jaundice. It's a yellowing of the skin and also the sclera, which is the white parts of your eyes. They turn yellow. When we look for jaundice, we really have a look at the eyes for scleral icterus. And remember that jaundice, so bilirubin and other toxins of the liver cause your skin to be intensely itchy. Okay. Kernicterus is a condition of newborns, and it can be caused from many conditions that are stopping the liver from processing bilirubin. There can be some congenital liver issues or blockages of the bile ducts in children, and they get very elevated bilirubin levels, which damage parts of the brain, and that would be called kernicterus. It's not very common anymore. We will often use ultraviolet lights to reduce bilirubin levels in children. So if you're ever on a pediatric wing or a neonatal intensive care, children will be put in lights, UV lights, to help the breakdown of bilirubin in the skin. And this is all in the hopes of making sure that bilirubin levels don't get to very dangerous levels. So kernicterus is much less common now.